Epidemiology is one of the most significant forms of science that has helped the world to end some of the most horrible diseases in history. Ranging from the polio outbreaks in the United States to the cholera pandemics that have swept the world, epidemiology is the epitome of important science and discovery. The study began around 400 BC when the Greek physician by the name of Hippocrates attempted to explain disease, basing his argument on a foundation of realistic and logical ideas. As the science continues to evolve, an exploration of different cures, exchange of information, and the encounter of new concepts and diseases occur, thus proving the pivotal role epidemiology has in history across the globe. While these topics of exploration, encounter, and exchange may apply to many remarkable people, events, and discoveries, epidemiology is one science that utilizes these three concepts in the study of pandemics and epidemics. Many epidemiologists explore potential interactions and environmental factors relevant to the causes of an epidemic. The exploration of such elements leads to the theorizing of different origins and causes for disease outbreaks. Yellow fever, a fatal viral disease that causes symptoms such as fever and jaundice, forced many professionals to search for causes of the deadly virus. The first evidence of yellow fever in the Americas was in 1648 and later spread throughout the United States and then to Europe. In 1730, one of the first outbreaks occurred, leading to 2,200 deaths reported in Spain, followed by epidemics in both France and Britain. Up until the 1800s, scientists believed that yellow fever was contracted by direct contact with contaminated materials and those who were infected. These ideas were supported by physician Valentine Seaman's exploration of areas where the diseases began. Although in 1848, American epidemiologist Josiah Clark Knott proposed that the vector may be a mosquito, and in 1881, Cuban physician Carlos Finlay further explored the idea and possibility that mosquitoes were the transmitting agent of yellow fever. Knott and Finlay's willingness to explore potential causes helped other epidemiologists to later find a vaccine. Epidemiology also includes exploring immunities to pandemics while additionally researching new medical ideas and concepts. Polio, an infectious disease causing paralysis, was first clinically described in 1789 by British physician Michael Underwood. The first U.S. polio outbreak occurred in 1894, resulting in scientists beginning to investigate those who are immune to the disease. Their exploration would be used to eventually find a cure. Soon after, poliovirus was found to be filtered in the spinal cord fluid of those infected, and in 1908, epidemiologists Erwin Popper and Karl Landsteiner injected monkeys with the fluid, resulting in the pair identifying the virus. 2 years later, MD Simon Flexner discovered germicidal substances in the monkeys who had survived the polio disease, helping to find antibodies to polio. The research and investigation of a plausible immunity aided in the creation of a successful vaccine for poliovirus, further supporting the importance of exploration in epidemiology. Encountering new illnesses, deadly diseases, new ideas, sciences, and discoveries come with the epidemiologist's profession. Finding each new illness introduces epidemiologists to the outbreak of an unknown virus. Encounters with the infectious and fatal bacterial disease known as cholera have occurred as early as 400 BC, but was only first recorded in India during the year 1563. While cholera had been present in India for centuries, the first pandemic did not occur until 1817. This first encounter with the deadly virus would be followed by a series of frequent pandemics over the course of several years. From then on, thousands would fall ill to the cholera disease, many of whom would die. These encounters with the severe worldwide disease would launch scientists into years of study and discovery. The encounter with the possible place of origin is also a major factor of the pandemic study. Following the first cholera pandemic in 1817, the disease spread throughout the Philippines, west to Africa and Turkey, and later reaching Indonesia, killing 10,000 people on the Java island. From then on, the cholera pandemic spread even further, finding its way to Iraq, again to India, later to Europe, and finally reaching the Western Hemisphere. This violent eruption of cholera pandemics was unexpected and forced epidemiologists to try and find the transmitter quickly as means to stop the widely spread diarrheal disease. During 1854, 500 people had died over the course of 10 days, and an overall 23,000 people in Great Britain had passed due to the cholera epidemic. Major epidemiologist Dr. John Snow began to research where the main source of cholera in London could have originated from. Prior to Snow's study, a discovery was made that cholera was spread through contaminated food and water, helping Snow to realize that cholera was infecting people through water being distributed by the Broad Street pumps. In addition to Snow's encounter with helping England to prevent more deaths related to cholera from occurring, he also proposed how to stop local outbreaks across the globe, causing the beginning of modern epidemic studies. An exchange of information between not only people of different professions, but also international groups of epidemiologists is a constant feature in the epidemic study. Finding vaccines, cures, and causes for diseases often require collaboration between basic scientists, public and medical practitioners, clinical geneticists, epidemiologists, and several other organizations. In addition to the exchange between the multiple professions, an exchange between international groups of epidemiologists through web-based communication and sharing of specimens occur. Not only do epidemiologists across the globe utilize the internet communication networks, but also meet to discuss and exchange ideas, discoveries, information, and research. The sharing of the different groups of people help to efficiently find cures and causes for outbreaks. Another major aspect of the epidemic study is the exchange of samples, information, shipments of equipment, and materials. To help prevent further spread of deadly viruses and infections, a global needle and syringe program was installed. The program was created as an attempt to reduce the spread of human immunodeficiency virus, otherwise known as HIV, and acquired immune deficiency syndrome, also known as AIDS, in drug users. HIV is a virus found in bodily fluids such as blood, breast milk, semen, vaginal and anal fluids, and is typically transmitted by the exchanging of such fluids. Due to HIV and AIDS often being found in drug users who shared injecting equipment with fellow addicts, the program deemed useful when suggested. The Needle and Syringe Program, which gained the name NSP, provided sterile needles for everyone. The program found a way to ensure that clean needles were at the disposal of all drug users, placing sites at outreach programs and pharmacies, along with having syringe vending machines. NSP helped to lower the percentage of drug users infected by the fatal virus. Currently, only 9% of drug users are living with HIV or AIDS, while during the 1990s, over 18% were infected. Needle and syringe exchange program became effective globally, and injection paraphernalia was exchanged between epidemiologists, providing drug users all around the world with clean equipment. Epidemiology is one study that proves to continuously utilize the exploration, encounter, and exchange elements of science. While the concept of exploration applies to the sciences, epidemiologists explore the potential factors that causes an epidemic, and the encountering of new illnesses are essential to advancements in science. Exchange of materials and ideas between different people help in the development of new epidemic research. Overall, the study of epidemiology has proved to be a vital element of history and large contributor to scientific improvement, but also continues to play an intricate role in society and modern-day science. These fundamental ideas support the connection between exploration, encounter, exchange, and epidemiology. As the study of pandemics have evolved and become more advanced, breakthrough discoveries, information, and cures continue to occur, showing the importance of the incredible science that is epidemiology.